Republicans are trying to rush a vote in order to pass a replacement for the Affordable Care Act. They have a deadline to do so if they plan to pass it with a simple majority. Now, there have been a number of people who have already criticized this replacement plan because A, they're just trying to rush it. B, they haven't given the Congressional Budget Office an opportunity to do an analysis on this legislation. And finally, it doesn't seem to be any better than what they had previously proposed. Now, Jimmy Kimmel is part of this discussion, which might shock some people, but he actually weighed in on the healthcare debate early on when he disclosed that his son had a rare heart condition, and luckily, since he has a certain level of wealth, he was able to provide healthcare to his child. However, if we repeal the Affordable Care Act, at least if the GOP does so, there is a big question mark in regard to whether or not people would be denied if they have pre-existing conditions, or if premiums could increase so much that even if they couldn't get denied for pre-existing conditions, people wouldn't be able to afford that health care because of how pricey it would be. Now, Kimmel decided to criticize Senator Cassidy because it turns out that Cassidy lied to him. Cassidy claimed that any proposal that he puts forward would pass the so-called Kimmel test, indicating that it would cover everyone regardless of whether or not they had a pre-existing condition. Well, Kimmel's read of the legislation indicates that that's not the case. So here's what's being reported. Kimmel did a long monologue recently, and his comments came during an impassioned monologue directed at Senator Bill Cassidy, who said in the past that any Obamacare replacement must be able to pass the Jimmy Kimmel test. Here's what Kimmel said: your child with the pre-existing condition will get the care he needs if and only if his father is Jimmy Kimmel. Otherwise, you might be screwed. Kimmel went on to say how Cassidy had in the past promised coverage for all, no discrimination based on pre-existing conditions, lower premiums for middle-class families, and no lifetime caps. And here's what he said: guess what? The new bill does none of those things. Not only did Bill Cassidy fail the Jimmy Kimmel test, he failed the Bill Cassidy test. He failed his own test. Now, Senator Cassidy has responded to Kimmel's criticism, and I want to share that video with you right now. Let's take a look.
What is your response, Senator?
I'm sorry, he does not understand. Under Graham-Cassidy, Heller Johnson, more people will have coverage, and we protect those with pre-existing conditions. States like Maine, Virginia, Florida, Missouri, there'll be billions more dollars to provide health insurance coverage for those in those states who have been passed by Obamacare, and we protect those with pre-existing conditions.
Well, the counter argument will be pre-existing conditions will be up to the pricing of the particular state and market. So it's not what it is now, where you can't allow insurance companies to cherry pick and punish people for pre-existing conditions. So the protection is not the same, Senator, on that one point.
The protection is absolutely the same. There's a specific provision that says that if a state applies for a waiver, it must ensure that those with pre-existing conditions have affordable and adequate coverage. But the
schedule of what people might pay that is out there making the rounds, pending a CBO score, which you guys have to wait for under the rules for this type of reconciliation. The price won't be the same as it is now. It's going to be different.
Actually, I think the price will actually be lower. What is being circulated is by those who wish to preserve Obamacare, and they're doing everything they can to discredit the alternative.
So Cassidy is just straight up lying in that segment. And he lies with a number of things. First of all, yes, it's true that the legislation says that insurance companies cannot deny people for pre-existing conditions. However, it also does away with Obamacare regulations that prevent insurance companies from charging you whatever they want if you do have a pre-existing condition. So under this plan, health insurance companies are expected to raise your premiums if you have a pre-existing condition, and the reality is they can consider anything a pre-existing condition.
Yeah, and there's a tiny clause that Senator Cassidy put in there. We said if a state applies for a waiver, there shouldn't be an if with a pre-existing condition. I mean, that's it. So let's say you're in a state that doesn't apply for a waiver. Pre-existing conditions, by definition, are not then covered. So if they're not applying for the waiver and the pre-existing condition isn't covered, even if they do apply for it, You have to apply for the waiver. There's a period of time where people with pre-existing conditions would not, by definition, in this Cassidy bill, would not be covered. So it's really false premise to say that. Now, he's right that if they apply for the waiver and then it could be covered, but Chris Cuomo's, I thought, asked great questions in that segment, because absolutely the scale is entirely different by state. So people who were previously covered may not be covered to the same extent.
Right, and also keep in mind that Cassidy in that clip claimed that this is gonna lower premiums. But based on what information? Because you haven't even allowed the Congressional Budget Office to do an analysis on this, which, by the way, bipartisan organization. You haven't even given them the opportunity to do that. You just want to jam this through a vote without any proper analysis. And what's incredible to me is, again, I made this point early on when we covered this story, but you guys failed so miserably with such an incredibly unpopular replacement plan, and it was embarrassing. And now you come back to the American people. Well, you actually kind of try to secretly pass this type of legislation, but now this is making headlines, people are paying attention, and you have the audacity to propose something that's just as worse, maybe even worse. We don't even know, because the Congressional Budget Office is not given an opportunity to do a proper analysis. Now, Lindsey Graham is also co-sponsoring this replacement proposal, and he also decided to not only defend Cassidy, but defend this replacement. Let's take a look.
And here's what I'd say to Mr. Kimmel. I understand the emotional nature of having a sick child, and we're all grateful your child is doing well. Bill Cassidy is a doctor who worked in a nonprofit hospital serving the underprivileged. Factually, our bill requires pre-existing illnesses to be covered in the block grant. We run it through the CHIPS program, the Children's Health Program, that's been in existence for 20 years. It's got to be compliant with the terms of that program. You do cover pre-existing illnesses, but we allow 50 states to come up with solutions to help sick people, not just some bureaucrat in Washington. And I bet you this, Brian, I bet you he never called Senator Cassidy and said, would you please set this straight? I bet he looked at some liberal talking point, bought it hook, line, and sinker, and went after Bill Cassidy without talking to him. And I think that's unfair.
I think he probably read what this legislation entails.
What everybody's doing. He had
right.
Bill Cassidy on his show already. And there's no way, it's so disingenuous for Lindsey Graham to say, I understand what it's like to have a child. No, well, you don't, because you don't have children. And so you'll never understand that in the exact same way that Jimmy Kimmel, I have a child and I don't understand because my child has never been in the situation that Jimmy Kimmel's kid was in. But it's what you were about to say is just so true. It's like, he looked at everything that's circulating. He's looked at what other senators, what Susan Collins, your colleague, Senator Graham, what Rand Paul looked at, what Democrats in the same chamber have looked at and said, this is absurd. This is worse than what you gave us last time, and we voted that down. So I take real issue with what Lindsey Graham said to his friendly Fox audience. Come on to this show, Senator Graham, and say those same things. You're saying that Jimmy Kimmel's doing it by looking at liberal media. No, why don't you come sit between Anna and me right now and let us ask you.
I would love to.
What about this bill and why it's not true? Because what you're saying isn't true.
You keep hearing the same GOP talking point play out in the media over and over again. And that talking point is, well, it's not fair. You know, some states like California are getting way more in terms of federal funds toward these healthcare policies. But the reason why states like California receive that money is because they agreed to expanding Medicare. The states that received less money did not agree. They refused it, okay? If they had agreed, they would have received money as well. And so that's what's really going on behind the scenes. If you are living in a red state that denied that money and you're paying a ton for your premiums, understand that that's what's working behind the scenes. That is part of the reason. It's because your lawmakers are not looking out for your best interests. They're looking out for their donors and they're looking out for political brownie points, and they're twisting the message in the media over and over again.
Support independent media. Come join us at the Young Turks. TYTnetwork.com/join.